Hello, my name's Priscilla Gates and I'm a Haematology Late Effects Advanced Practice Nurse and also a Nurse Project Manager with the Australian Cancer Survivorship Centre. Today I'm speaking to you about living well after a diagnosis of lymphoma. The outline of my presentation will be whose lives are affected by a diagnosis of lymphoma, define late effects of treatment for lymphoma, and discuss with you the emotional impact, the information needs that are often experienced by survivors of lymphoma, the healthy behaviours that we recommend, and supports that are available to you locally and more globally. Life after a diagnosis of lymphoma. What is a survivor? A survivor is a common but inconsistent term which has often been used to describe people who have finished treatment and more renowned for people who have finished curative treatment. However, more recently, the term survivor has also been used for people who are diagnosed with the cancer and the disease is being kept at bay, which is described as a watch and wait. A survivor can also be someone who is going through treatment and we are trying to control the symptoms of lymphoma. A commonly known definition of a cancer survivor is a person diagnosed from the time of their diagnosis through the balance of his or her natural life. The definition of survivor can also include family, friends and caregivers, as they are also impacted by the diagnosis of lymphoma and are also included in this definition. So survivorship is about learning how to live well after your diagnosis, regardless of your prognosis. So what is a late effect of treatment, in particular to patients who have been diagnosed with lymphoma? A late effect is any chronic or late occurring outcome that may be medical or psychosocial resulting from the treatment of cancer. Some late effects may not become apparent for some years after completion of treatment, but some late effects may not become apparent for 10 to 20 years after treatment completion. To treat lymphoma and kill cancer cells is generally very toxic. And this toxic therapy can also affect normal tissues and organs within the body. Some of the potential late effects of treatment for lymphoma include second malignancy. And this is a new cancer and is usually related to the treatment that you have received prior. You can also experience cardiac dysfunction, and this can be from effects of the chemotherapy or radiation that can affect the heart function in the future. Endocrine dysfunction can occur, and this can be mainly thyroid function from the thyroid gland in the neck, because a thyroid gland can sometimes be in the radiation field. And also alteration to sex hormones, which can then alter our fertility status. Fertility can be altered from chemotherapy agents and also radiotherapy exposure. Another common impact of cancer treatment is psychosocial challenges, and this commonly presents as anxiety, depression, or a feeling of loss. And loss describes the feeling of lost opportunities that have occurred in your life because of your diagnosis of lymphoma. The development of late effects. This is multifactorial, and if you're at risk of late effects, takes in a lot of other factors in your life. And to describe these, in particular pre-cancer conditions, describing how healthy you were before your diagnosis of lymphoma. You may have hypertension, high cholesterol, diabetes, asthma. Also hereditary and genetic factors, that because of your genetic makeup, you may be at higher risk of developing other conditions. The cancer type puts you at more risk of late effects. In particular, patients who have treatment for blood cancers, including chemotherapy and radiotherapy, are at high risk. And also, adult survivors of childhood cancers, particularly brain tumours and some solid tumours, are also at high risk. The treatment exposure. In particular, patients who've received radiation therapy to large areas of their body are at risk of late effects later in life. And some chemotherapy agents, particularly the dose they have received, puts them at risk, and also surgery. Importantly, health behaviours, how healthy you are and what sort of lifestyle you lead, which we will talk further about. If you smoke, your activity levels and your diet can put you at future risk. And also as you age, you will be exposed and develop other comorbid conditions related to the process of ageing, which can also put you at future risk of developing late effects as a result of having lymphoma. The emotional impact. Many cancer survivors report that after having a cancer diagnosis, and many who have had lymphoma report and describe the emotional impact of their diagnosis. They can describe that they have real uncertainty about their future. Is the disease going to come back? Is the cough? Is the lump? Is the worry? Is the feeling of fatigue related to their cancer? Many cancer survivors want to forget their cancer, but on a day-to-day basis they have reminders. They're worried that becoming a hypochondriac, that any common symptom they experience is a symptom of their lymphoma. And they also experience great anxiety about future testing, seeing their healthcare professionals, that a problem will be picked up. Life after a diagnosis of lymphoma is not the same as your life prior to your diagnosis of lymphoma. Change will be inevitable. However, many people describe that they have an increased satisfaction after having a diagnosis of cancer. They may not get caught up in the day-to-day little things that they had been caught up with previously. They may have an increased awareness of true friendships and what's really important to them in life. And they also may have a real awareness to get the most out of life and to get the most out of every day and live each day. You cannot change your diagnosis, but you can change the way you respond to it. Many survivors of cancer also report great unmet information needs related to their diagnosis, related to their treatment, and also related to when their treatment has completed. They may have questions about what sort of follow-up and surveillance they require. What tests do they need? How often do they need these tests? And why are they having these tests? They may have questions about the late effects of their treatment, that they've received this chemotherapy and radiation, and what may be the long-term effects of that exposure. As we described, emotional impact, how to get support for this. Is it normal the way you're feeling? The impact on sexual function, intimacy and relationships, and also an impact on your fertility. Are you able to have children after the exposure of your treatment? How do you return to work? How do you pick up your career, your study? How do you get back into your workplace and pick up from where you left? Finances, particularly if you are the sole wage earner within the family or your living circumstances. Role changes, and these can definitely change as a result of having lymphoma, living with lymphoma, or surviving lymphoma. And also health promotion. What sort of health behaviours should you be living, and what sort of lifestyle should you be leading? And we will describe that further. We recommend cancer survivors or people living with their diagnosis to abide by the Australian Government healthy lifestyle recommendations. In particular, we highly recommend that patients diagnosed with cancer, living with cancer, or cured of cancer do not smoke. It is recognised that smoking is the largest single preventable cause of death in Australia. However, 16% of Australians continue to smoke. We recommend to limit alcohol intake and have no more than 2 standard drinks of alcohol on any given day. Diet. Being overweight or obese is related to many cancers, cardiac disease and other conditions. So we therefore recommend having a healthy weight range. And this can be achieved by including the 5 food groups in particular, and also making sure that we can have 2 serves of fruit or 5 serves of vegetable per day to make sure we are having a balanced diet. Exercise. Similar to diet, a sedentary lifestyle is linked to many cancers, heart disease and other conditions. We recommend you to practice at least 30 minutes of moderate to intensive physical activity on most days and preferably all days. However, you need to take this into context of your own situation if you are well enough to do that sort of activity. We really recommend that we do as much that you can possibly do and is right for you on that particular day. So how do we gain more support? How do we have our unmet information needs, our unmet emotional needs, and feel more supported as we go through the journey of having lymphoma, being treated with lymphoma, or being cured of lymphoma? We recommend, if you do have questions, that you talk to your treating doctor, your nurse, or any other healthcare professional who's involved in your treatment. When your treatment completed, you can ask your healthcare professional for a treatment summary or a survivorship care plan. This survivorship care plan becomes your document and is a summary of the treatment you received, the chemotherapy, the radiation therapy, what ongoing surveillance you require, what supports are available to you, what sort of health behaviours we recommend, and also a follow-up plan that's tailor-made to your needs. We also encourage you to keep in close contact with your GP, making sure that your GP is up to date with your treatment and is what's going on in your situation. A GP is a fantastic contact in the community. You may also be eligible for a chronic illness care package that you could talk to your GP about. And finally, the Leukaemia Foundation. The Leukaemia Foundation is there to support you at diagnosis, throughout your treatment and after your treatment has completed. If you have any questions or queries about your treatment or diagnosis or after your treatment is completed, the Leukaemia Foundation will be there for you. You will talk to a healthcare professional who will be able to support you with your needs. Thank you.